pace. Presently, nearly 190,000 people are on average being vaccinated every day, every weekday. Government and the private sector are working together in an unprecedented way to build additional capacity to vaccinate many more people on a single day. We are currently vaccinating both the 60 and 90 age groups. From this coming Thursday, the 15th of July, those over 35 years of age will be able to register on the electronic vaccination data system. On the 1st of August, we hope to commence with the vaccinations of the 35 plus. And this is when I will hope to see our vaccination program achieving the objective I've set out for IMC and all those who are involved in the vaccination program, which is more than 300,000 a day. Programs are underway to vaccinate essential workers, starting with basic education, the police and defense, and those are carrying on. The Department of Health is also working with the private sector to implement workplace vaccination programs that can expand our capacity beyond public sites. We are working to ensure that vaccination sites are located closer to where people live to make it easier for them. We will continue to work with community, religious, and traditional leaders to mobilize communities to get vaccinated. Plans are in place in all provinces to expand many sites to vaccinate either 6 or 7 days of the week. And this will be achieved by the provision of funds for overtime and recruitment of additional medical staff and health science students, which is now underway. All those who qualify for vaccination are encouraged to pre-register to speed up the process at vaccination sites. However, all sites do also allow unregistered people to walk in and to be registered. Now I'd like to encourage all South Africans who are eligible to register to do so and to get their vaccine. Kubalulekile ukuthi sonke iningi lethu lizinike isikhathi ukuthi siyojova. Go botlhokwa haholo hore re iphe nako hore re ilo tlhabiwa ka vaccine ena. We need to spread the message that vaccines do work and that they are effective. Vanhu van'wana va hleketa ku ri swilo leswi swa ti-vaccine a swi tirhi. Ni lava ku ta tivisa vanhu ku ri swa tirha leswi swa ti-vaccine. A hi ti nyikeni nkarhi ku ri hi ya tlhabiwa ku ri vutomi bya hina byi humela emahlweni. One of the major challenges we've faced so far in expanding our vaccination program is the availability of vaccine doses. This has been a challenge both for our own country and the rest of the African continent. In the last few days, the African Union, through our office as the AU COVID-19 champion, and the European Union have reached a historic agreement that will significantly improve the supply of vaccines to our country and our sister countries on the African continent. Through this agreement, Aspen, which is based here in Gqeberha, will be delivering over 17 million Johnson & Johnson vaccine doses to South Africa and other African countries over the next 3 months, commencing in July. Now, Johnson & Johnson, as we know, requires only a single dose, which is quite appropriate for many parts of our country, and indeed our continent, because with the distances that people have to travel, it is best that they travel once and just get the one jab. Now, this number will double monthly from October. Initial stock running into millions of doses will be released in both South Africa and other African countries from July. As part of the effort to strengthen health security on the continent, there is a commitment by Johnson & Johnson to adapt the current arrangement so that we can produce the vaccine in South Africa under license rather than under contract. This will result in our country and the continent having control over the vaccines that will be made available. We are negotiating that in time, the drug substance, which is like the concentrate that makes the vaccines, itself should be produced here in South Africa so that we have a fully owned African vaccine manufactured on African soil in a number of countries on our continent. We welcome the announcement by President Joe Biden that the United States is donating 15 million doses of the Pfizer vaccine to African countries through the COVAX facility. These developments, together with our current agreements with manufacturers, means that South Africa should have a pipeline of vaccine supply sufficient to meet our vaccination target. Now, this is a result of the work that has been done by a number of people to get to a point where vaccine availability for us is no longer a challenge. At the same time, we are working to expand the range of vaccines being used in the country. We welcome the decision by SAPRA to approve the CoronaVac vaccine from China for use in South Africa. The Vaccine Advisory Committee is working on how soon we can bring CoronaVac into the vaccination program. We are also looking at a whole number of vaccines, and the one positive news we received was that Cuba has also been able to finalize their own vaccine. We've had to make difficult decisions, knowing that almost every decision carries a cost to the economy and to society. Despite the economic impact of these restrictions, we need to appreciate that it is the pandemic itself that poses the greatest threat to economic recovery. A prolonged period of uncontrolled infections would cause far greater economic damage than the restrictions put in place, disrupting production and deterring people from venturing out to entertainment venues and public places. We recognize, however, that these restrictions have had consequences for individuals, for households, and for businesses that were already under pressure before the pandemic. We remain committed to do all that we can to mitigate the impact of lockdown on people's livelihoods. Following the move to Alert Level 4, the Unemployment Insurance Fund embarked on negotiations with social partners, they being labor, business, community-based organizations, and of course government, to address the difficulties that employees or workers who lost income under these restrictions. On the basis, the UIF decided that the COVID